Thank you very much, Madam Chair, and thank you, Commissioner, for your testimony today. These are all very important questions that we're asking. My question goes to, since the start of the pandemic, the regulatory goalposts have never stopped moving. And in many ways, these government-based decisions can hardly be considered science-based if there's no quantifiable metric, at which point we can reach back into everyday normal life. So my first question is, what metric does the state have to reach in regards to COVID-19 cases to stop issuing these mandates?
And my answer to you, Senator, and this is a question that I get a lot, is that there is no single magic number that we look at and say this pandemic is over, except 0 cases, which we all know is unlikely to occur anytime soon, especially as we've been unable to vaccinate most of the world. So we look at the number of cases that are testing positive. We look at the number of people who become sick and are hospitalized. We look at the number of people who become very sick and may need intensive care services. And we look at all of these together, and we look at the overall context. Are trends going up or are they going down? We are in a good place now. With every day, all of the numbers that I've mentioned to you have been going down. I looked at the numbers right before I came over, and today we had, and these are from 2 days ago, the most recent public data, about 3,800 people newly diagnosed with COVID, and the number of people admitted to hospital was 422. We still have over 5,000 people in the hospital. On December 1st, when this all started, we had 3,000 people in the hospital with COVID. So by some measures, we're still high. And
thank you, Commissioner. I want to get on to my next question, but there has to be some end in sight for the people of the state of New York.
There is an end in sight.
Everyone is so ready for this to come to an end. On January 28th, the governor announced a continuation of the indoor mask mandate until this Thursday, the 10th of February. She committed to reassess this mandate every 2 weeks. COVID cases, as you just indicated, are in steep decline. If there is a sincere intention by this governor to reevaluate the mandates every 2 weeks, why does the department need to promulgate these rules and make them permanent?
I have to try and understand what the promulgating the rules and making them permanent means. All of these have been done by executive order, which have to be renewed from time to time. Can you just explain that to me?
Well, it just seems like, the ordinary rulemaking process has been overlooked, and it creates a lot of confusion and alarm amongst parents, school children, people who own businesses. Many school administrators are confused and frustrated by this permanent promulgation of these rules. And there's no leveling, and there's no clarity, and there's no end in sight.
No, thank you again. The things that have been done by rulemaking are, as I understand it, if I'm following, around vaccinations. So we have made requirements for vaccination among health workers, and we recently extended those requirements to requirements for boosters. It's clear that vaccinations have an important role in our response. They protect people from severe illness and hospitalization, and boosters make it even more likely that you will avoid severe illness and hospitalization. That's why we have moved to protect our workforce, which we've been talking a lot about today, and which we need to in order to go forward with our pandemic response. So that is something that I think that we'll have for some time to come. We need to have a vaccinated health workforce.